The brush represents a dramatic breakthrough in how we remove the corneal epithelium in PRK. There are a number of distinct advantages of using the brush compared to other epithelial removal techniques. One is it's very quick, it's very fast, and there's less chance for stromal dehydration and the potential for overcorrection. It has a very high acceptance rate among patients, doctors, as well as prospective patients that are observing the procedure. It allows for faster epithelial healing because the edges are extremely smooth. And I have observed over the past year that the corneas appear to be clear. I have found a big advantage of the brush in retreating patients that are undercorrected or even overcorrected now that we're using the laser for both myopia and hyperopia. The epithelium comes off extremely easy with the brush, and it's far easier than with mechanical removal, whether it be with a blade or with a spatula.
The Amoils Epithelial Scrubber is used to remove the corneal epithelium prior to PRK. The following section will help you visualize the proper steps and procedures you need to know to obtain maximum effectiveness of this simple, innovative technique. First, place topical anesthetic on the eye. Center the treatment eye under the microscope and turn on the fixation occluder. While asking the patient to focus on the green light, tape the fixation occluder in place. Using a gloved hand, unwrap the sterile inner pack containing the Amoils Epithelial Scrubber and mount it on the neck of the power handle. Set the microscope at low magnification. Insert a lid speculum. Check that the patient is maintaining fixation on the occluder light and that the treatment eye pupil is centered under the microscope. Mark the area of the epithelium to be removed with a corneal marker. Place a few drops of chilled BSS on the inverted scrubber tip. Also, place a few drops of chilled BSS solution on the patient's cornea. Turn on and bring the Amoils Epithelial Scrubber gently in contact with the patient's corneal epithelium, using the microscope to keep it centered. Within a few seconds, the epithelium will be removed in the specific zone centered around the pupil. Now, as we review this procedure again under higher magnification, note the edges of the zone are much smoother than with manual removal methods. Observe the glistening exposed surface of Bowman's membrane. If you are not sure that all the epithelium has been removed, lightly rebrush the remnants with a circular movement, or wipe with the rotating tilted edge of the brush, plus or minus 15 degrees from the vertical. Wipe Bowman's with a moistened microsponge to remove any loose epithelial debris. The fixation occluder should now be turned off before proceeding with PRK. The Amoils Epithelial Scrubber is that simple and efficient. It performs quickly and easily and always gives a uniform result. Surgeons have found the brush to be particularly effective in laser retreatment. It uniformly removes the tougher bonds of regrown epithelium to produce a Bowman's bed far smoother than any prepared by mechanical techniques. Here are a few additional tips. Use a gentle circular motion while applying the brush to the eye. This will prevent a central area of residual epithelial tissue and can be used to control or enlarge the zone of epithelial removal. Always wet the cornea and brush with chilled BSS solution prior to use. Turn the brush on before placing it on the eye. It is often useful to prepare the patient for the sound the brush will make, as it creates a smooth surface in preparation for the laser procedure. Be sure to turn off the fixation occluder before proceeding with laser ablation. On the first few patients, it might be helpful to visualize the brush from the side instead of through the microscope. Center the brush white to white. This will help familiarize you with the action of the brush as it contacts the corneal surface. Flood the ablated cornea with chilled BSS immediately after the PRK procedure for 7 to 10 seconds to re-equilibrate the corneal temperature post-PRK. Once you realize how simple it is to use, your confidence in using the Amoils Epithelial Scrubber will be almost instantaneous.
The learning curve with the brush is relatively short. Most surgeons become comfortable with the brush after a few treatments. There are a few things to keep in mind when starting to use the brush. One, it's best to have under fairly low magnification, a little lower than what would normally use for simple just PRK treatments. The other point is that when you have the brush, it's best to have almost a mild circular movement when pressure is applied to the eye. And usually after about 2-3 seconds the epithelium comes off and the surface is very smooth.
The Amoils Epithelial Scrubber, an impressive innovation for laser eye surgery.